It's probably fair to say that as General Motors goes, so goes employer-based healthcare in America. After all, GM started the whole thing in 1950 as a protective move to prevent the regional UAW from the Toledo area from organizing its first collective benefits program. To avoid what they viewed as a dangerous worker precedent, they not only provided health care for the first time in America, but pensions as well. A half a century later, their successors in the executive suite must be saying, what were they thinking? After a good decade or two of complaining about healthcare costs and trying everything that they could to rein them in, GM is finally cutting the cord. In late September 2007, GM and UAW agreed to transfer control of the health benefits to a trust managed by the UAW itself. GM will infuse the trust with $32 billion, which they're more than happy to do considering their liabilities. Currently, promises for health care to the employees and retirees amount to double the current value of all outstanding stock in GM. Plus, GM has lost $12 billion in just the past 2 years. Now, both GM and UAW saw this coming. During the heydays, the UAW demanded and sometimes after strikes received ever higher pay and benefits. But that was before Toyota, Honda, and all the rest. Of late, the UAW is more focused on saving jobs than enhancing benefits. The truth is, the U.S. auto industry, or rather the U.S.-owned auto industry, is in decline. GM believes better managing their healthcare obligations for 412,356 union members, retirees, and surviving spouses is the key to success. And the UAW agrees. Over time, the trust will be funded to 70% of its $51 billion obligation. The UAW gets hard cash, so that if GM went under, at least the GM former employees wouldn't lose everything. And as one Citigroup analyst said, quotes, if you're a creditor, you'd rather negotiate when the debtor has liquidity and cash, which is a situation right now, close quotes. And for GM, well, they attacked the cost gap. Hourly wages at GM, Toyota, Honda, and Nissan are about the same, $25 an hour. It's the benefits that create the gap. GM has to add $45 per hour, while the non-U.S. automakers add about $25 per hour. Dropping or at least freezing the cost of benefits will help, as will lowering the number of employees. The UAW had 1.4 million members 50 years ago. They're now down to roughly 500,000. GM has 74,000 active UAW employees, that's all. But it provides benefits to 340,000 UAW retirees and surviving spouses. And Toyota? Well, they cover retiree benefits for 250 Americans. At the end of the day, this might spell some relief for GM. But unless they can sell more cars, the relief is going to be short-lived. As for the UAW, unless they can use their funds efficiently to counteract healthcare inflation, or unless universal health care somehow intervenes, they have a real monkey on their back. All in all, it's a strange full circle that only rough-and-tumble capitalism could create. Step 1. Industry offers preemptive benefits to control the collectivization instincts of their own employees, who are seeking security by sharing the burden and spreading the risk. Step 2. Employees accept the bounty. They run with the ball. They leverage their employer's fear of collectivization for all it's worth. Step 3. The employer wails, and finally the company declines, shrinks, and dumps employees as quickly as they can. Step 4. Unionized employees weigh continuing the fight against the risk of total collapse. That's jobs, not just benefits at stake. Step 5. The unions and employees take back the liability they intended to burden themselves way back in 1950. Only in America could we take such a convoluted and complex course and in the end accept such an incomplete solution. For Health Commentary, I'm Mike McGee.